Good morning. Today we'll talk about two conditions that are encountered more than you think in our clinical practice, but are often misdiagnosed. These are conditions that cause non-specific chest pain and are costochondritis and sleeping rib syndrome. So the first question is, are they the same thing? And the answer is no, they are two different things. Costochondritis is an inflammation of the cartilage that joins the bony part of the rib to the sternum. Whilst sleeping rib syndrome is caused by misalignment of the ribs in the bottom part of the rib cage. The second question is, how do you treat this condition? And in case of costochondritis, this can be caused by repeated strain injury, and you just need to take some normal anti-inflammatory drug like ibuprofen and rest for a little while. In case of sleeping rib syndrome, then you can ask a chiropractor for some manipulation, or in certain cases surgery is necessary to realign the rib or removing the poking part of the rib. The other question that I'm asked quite often is how you diagnose these two conditions. In the case of costochondritis, there isn't much you can do. Mostly is a clinical diagnosis, and so unfortunately is the case of sleeping rib syndrome. I had a lot of patients that came to me with numerous investigations, chest X-ray, CT, MRI of the chest, and they are all pretty much normal. One maneuver that is quite characteristic of sleeping rib syndrome is called the hooking maneuver, when you actually hook the bottom part of the rib cage and you reproduce the pain that patient experience. Can the two conditions be confused with other medical condition? And the answer is yes. In case of costochondritis, it's always mistaken for either heart attack or a pneumothorax, but the type of pain is a little bit different. In case of sleeping rib syndrome, there are patients that report this to be like gastric reflux, or when it's on the right side, gallbladder problems. But actually a careful history taking should make the diagnosis a little bit clearer. I hope this is going to be informative enough for you. As usual, if you have any doubts, please do get in touch.